Good morning, good afternoon, good evening. Thank you for joining us today. My name is Elliot Sloan, and we are here to all participate and learn about digital health, clinical engineering, and 21st century healthcare. It is a professional webinar in our series of professional webinars to enhance the collaboration and communication between engineers, physicians, and the entire community. We are learning and growing together. We have an incredible community of valued colleagues and friends who will be presenting throughout this webinar. I would like to just take a few moments to go over the agenda that we have. I'll be doing some greetings and introductions. We'll have some greetings from the Clinical Engineering Society. We'll have some greetings from the global clinical engineering community. We will have a presentation from the Ministry of Health regarding the incredible progress that has happened in Saudi Arabia over the past decade. And we'll then have an open discussion and answer your questions. And we will spend some time talking about future webinars that we're able to and hope to present for the kingdom and for the entire Middle East and Northern Africa community. And then we will close. We're allowing about 90 minutes for this. For myself, I have a long and interesting background that has included a medical device safety, forensics, design, manufacturing for 10 years. And for 20 years, I've been a professor, a consultant, an advisor, a businessman. I run a couple of foundations. I sit on many boards and have the privilege of working with the World Health Organization since 1978 as an advisor and trainer. I have a long and wonderful history with the Kingdom of Saudi Arabia and Middle East clinical engineering and digital health programs. In the digital health space, I was a speaker in Dubai in 2010. I was also a speaker in Kuwait in 2012 with the military hospital. I had the pleasure of being in Riyadh with Dr. Balkhair in 2013 to talk more about the integration and convergence of medical technologies and digital health. In Abu Dhabi in 2014, we did a number of discussions about medical devices in particular and medical technology integration using open source standards. My partnership with Saudi Arabia actually goes back to 1978, believe it or not, before many of you young folks were born. The King Faisal Hospital was brand new, and my organization, ECRI, helped establish the biomedical engineering programs and services at King Faisal Hospital. I have lifelong valued friends, Dr. Al-Madani and Dr. Al-Fadal, who ran and expanded the King Faisal Hospital programs and have become mentors and friends for life. Saudi investors purchased our hospital maintenance program, and it became renamed as International Shared Services. And it's actually now part of Geisinger International Shared Services. This is an exciting field. We're all here for a very common reason. We love our country, we love our children, we love our family. We are making a huge difference. This is just one simple example of this tiny child who was under 10 ounces or a half a kilo, a little over at birth, and has survived to have a long, healthy life. In my lifetime, in your lifetime, miracles have been accomplished, and in the coronavirus, the creation of vaccines in less than a year is no small feat. It's amazing progress that we are making and have made. You're not alone. Wherever you are working in this field, you have a global community of committed colleagues in the engineering and healthcare field. And part of this presentation is to reassure you of that and open our dialogue. I want to thank you personally for the invitation, privilege, and opportunity to collaborate with you, because this is an amazing opportunity that we face to improve the world through technology and through our leadership and our dialogue and collaboration in these 2020s. Without further ado, I'd like to turn over the floor to my friend and colleague, Tom Judd, to talk about the international programs that we're doing.
Thanks, Elliot. It's great to be here. I echo all of your comments that you do have a family around the world. I want to speak very briefly about not only clinical engineering. Some people around the world call it biomedical engineering. We take our reference terms from the World Health Organization. You know, that life cycle management role that we have with medical devices, but as Elliot has clearly said, over the last 10 to 15 years, the emerging digital health role that clinical engineers have alongside health technology management. And notably this year, your global organization, IFMCED, that I represent today, has had a huge response alongside, partnered with WHO to the pandemic. Not to belabor other things on the front page, other than I have the privilege of working with the HIMSS globally around telehealth, and 25 years with Kaiser Permanente and a long association with WHO. Next, please. So the International Federation Medical and Biological Engineering Clinical Engineering Division, the parent organization about 60 years old, the CED, the Clinical Engineering Division, about 50 years old, but really gained some new momentum about a dozen years ago with my colleague, Dr. Yadin David, and others. So we had Dr. David imagined and put into place a global summit at a first global Congress, International Congress in 2015 in China. That was, 15 countries represented, and then we started to grow. And our second summit in Brazil in 2017, 30 countries, and then last year in Rome, 48. And you'll hear about continued growth. And so we are the largest federation of clinical engineering, biomedical engineering societies around the world that have our role in healthcare, particularly in hospitals, but also industry and academia. And actually just a month ago, a new entity, the Global Clinical Engineering Alliance, GCEA, was born. And you can see a lot about Global CE Day and Global Alliance at that link that I provided. And I'll say more about this upcoming summit next September. We think the world will be open up, and we want you to join us and many other countries in Disney World. Next. So we've grown now to a 270-person board and collaborator team from 106 countries. Adriana Velazquez at WHO called us in March and said, help, and we've come alongside in a major way. And we daily and weekly connect with health technology leaders today in 170 countries. Next. So what was the picture in Rome a year ago at our big Congress? I mean, we had 1,000 registrants from 70 countries. We were so proud of that, but it turns out that's a platform for growth. Next, please. I should mention, though, WHO, many of you know the World Health Organization, the medical device unit's vision for health technology management around the world, including better access, better affordability, creating a health technology unit at the Ministry of Health level, empowering ourselves. They measured 800,000 of us in 130 countries a couple years ago there at WHO. And then we're all about innovation and about getting the right regulations for medical device to increase quality of care. Next, please. So as we built on that platform, we put into place pandemic webinars sharing best practices around the world about how to deal with COVID-19. It turns out WHO defines PPE as a medical device. Of course, all the respiratory equipment, the oxygen systems, then all the disinfection, decontamination of this stuff. With WHO, we've put on a dozen webinars this year with 145 countries participating. So we've really grown even beyond that 139 there on the graphic to regular involvement with 170, as I mentioned. Next, please. So, but what have we actually done? Well, we created a knowledge network since March. We put on these global webinars I mentioned. We have these large board and collaborator meetings monthly where we share, and Adriana comes from WHO and we provide the experts that she needs. Next, please. So not only the webinars, not only the regular meetings, we push out Adriana's WHO medical device newsletter monthly, and to make sure people around the world have that. She connected us to some of the global coalitions, like Every Breath Count Coalition, that has the World Bank and Gates and other many foundations involved in it. Fourth, we provide a WhatsApp group that many of you have joined, now 140 subscribers from 50 countries, where daily we can ask questions about CE, HTM, our COVID-19 best practices, and so on. Next, please. And last, in this knowledge network we've created, we also, actually Dr. Sloan leads this. There's a team of us that meet every day at 10 a.m. Monday to Friday and put out a newsletter of vetted and validated information about best practices around COVID for many categories you see there on the screen. So, and this is, I think yesterday was the 175th or 174th one of these Monday to Friday newsletters. Make sure you sign up for that. Next, please. So as a result, we've brought our clinical engineering systems approach to this incredibly challenging pandemic. I've already mentioned, what are the topics that we're bringing this approach to: oxygen, PPE, CPAP, BiPAP, pulse ox, ventilators, decontamination, and really what are the requirements, what are the accessories of support, training, coordination of all the activities. In the best sense, we're at the Ministry of Health level, a part of the team speaking into decision makers about how to wrestle with this terrible situation. Next, please. So we have ongoing partnerships. Mr. Farah here from Lebanon leads a work in the Middle East, North Africa, and brought together this team you see in a webinar around COVID in Middle East, North Africa, IMRO region of WHO that we held back in July. And we have many other activities like this one today related to that. And you see we're facilitating work in the regions around the world. And we don't take the credit. It's not about what CED has done. It's how we empower you in your region to make a difference. And we're actually now even working with WHO around COVID on, there's so many innovation submissions came into WHO around all these medical device COVID related issues. And so CED and this new alliance are wrestling with that and bringing our network together to evaluate these submissions. Next, please. So, we're not done yet, but we are sharing knowledge. You've heard that. We try to cross language barriers, and we're doing that pretty well. 8 or 10 major languages. We're creating guidelines. We're promoting the profession and growing it, empowering it, and we're encouraging you to keep on doing your new ideas and your new initiatives to make a difference to improve outcomes. Next, please. So in closing, we've had not only these WHO, CED, COVID-related webinars this year, we've had several competency webinars. There was one on digital health in August that actually brought 150 colleagues there from the Kingdom together among the 350 people that registered that day from 60 countries. And we facilitate like the IMRO conference I mentioned in July, and you see one from Colombia we did here also in July. So we're empowering the regions. Next, please. So in closing, hey, join us. We're going to Disney World next year in late September. Like I said, everyone believes the world will be open. The vaccine will be working. We'll be able to be face-to-face, but you could join us virtually. So last time, as I mentioned, 70 countries, 1,000 registrants. This time in 2021, 10 months from now, we expect a bigger group, 100 countries and, so forth. So please consider joining us for that. And back to you, Elliot.
Thanks so much, Tom. And honestly, we could not have done this without your inspirational leadership and commitment to the entire globe and inclusivity to all participants. We now, I want to mention to you that we will take questions throughout this session on the Q&A tab that you have. So if you have questions for any of us or about any of these topics, please don't hesitate to post those questions. And we will, at the end of these presentations, come back to that stack of questions and answer them and discuss them.